Sure, sure, sure. Okay.
Are we starting?
You all are live, sir.
Okay.
Hello. Hi. Ma'am, Rutuja here. I've sent you the link.
Yeah, I know the Shakti, network has gone off. I reach away because it's Gmail and it's like
Yeah. Yeah.
Good evening. On behalf of Organized Medicine and Academic Guild, we thank NTOD for the platform and also helping us to celebrate World Hearing Day. So with us, we have Dr. Uday Bodankar from ComHead, and also he represents OMAG. And we also have, thanks to Dr. Raja Lakshmi Rao, just joined. Welcome, Raja. And Raja is the president of hearing.
Can you hear me now?
Yeah, yes, Raja. Welcome.
Sorry.
Thanks for thanks for joining us. So I have a brief introduction of the World Hearing Day today, where WHO is celebrating, and also from Organized Medicine Academic Guild, along with NTOD, we are celebrating World. Can I have the presentation? I'm just sharing my screen. You can see my screen?
We can't see it.
One second. Now?
Yes.
We can see.
Okay. So World Hearing Day this year is celebrated on 3rd March 2021. That's today. Hearing care for all, screen, rehabilitate, communicate. And this is a brief introduction. The hearing loss is on the rise. Factual details: around 466 million people worldwide have disabling hearing loss in 2018, and 34 million of these are children. It is estimated that by year 2030, 630 million people and over 900 million people by the year 2050 will have disabling hearing loss. And 1.1 billion young people aged between 12 to 35 are at risk of hearing loss due to exposure to noise in recreational setting. And this is almost equal to population of India. And what is means for countries? High cost to health system. Adults with hearing loss also have a much higher unemployment rate, increased need for ear and hearing services, and increased human resource requirements. And unaddressed hearing loss poses an annual global cost of 750 billion international dollars. And this trend is possible to combat. It is anticipated that nearly 1 out of 10 people by year 2050 could have hearing loss. But this could be avoided by prevention measures such as protection against loud sounds, good ear care practices and immunization, timely and appropriate interventions. People having hearing loss or related ear diseases should seek care from a healthcare provider. Factors are responsible. Risk factors over one's life impact hearing. Some includes genetics, maternal and childhood infections, ear infections, noise, ototoxicity. So quick statistics and deafness in India. Hearing impairment cannot be seen, hence its effects are not visible to our deaf sufferer in silence. Unlike blindness, deafness often provokes ridicule than sympathy. In India, 63 million, 6.3% suffer from significant auditory loss. 4 in every 1,000 children suffer from severe to profound hearing loss, with over 100,000 babies that are born with hearing deficiency every year. It was estimated that the number of persons with hearing disability per 100,000 persons was 291. It was higher in rural, 310, compared with urban regions, 236. In the same survey, about 32% of the people had profound and 39% had severe hearing disability. Person could hear only shouted words. What role can you play? As a part of civil society, advocate with policymakers for resources for hearing care, and that's why we're all here. Disseminate awareness and behavioral change campaigns, engage opinion leaders and media, and advocate for and support government's awareness program and screening. What role can, as a health professional, educate on risks, refer patients for tests and treatment, monitor patients taking ototoxic medicines, support those who need hearing devices or sign languages. As a policymaker, establish training program, make available high quality, affordable devices and other communication services, adopt legislation on sound exposure. And conclusion, we hope that the World Hearing Day 2021 will be a massive call to action all sectors can demonstrate their leadership by making this year's event the largest one the country has ever seen. So thank you very much. And with this, I now request Dr. Uday to make his presentation.
Yeah. Thank you, Honorable Dr. Natarajan sir, Padma Shri, and President of OMAG. OMAG, for your information, OMAG is an organized medicine academic guild, an organization of more than 25 national medical organizations and ICMR, WHO, Ministry of Health as an advisor. And we have got more than 250,000 and 250,000 specialists under the banner of OMAG. And I'm really honored to share my distinct with Honorable Padma Shri Dr. Natarajan, who is the president of OMAG 2020-21. We are also honored to welcome Professor Rajalakshmi Rao Madam, who is the founder chairperson of All India Foundation of Deaf Women. Madam, thank you. My organization is Commonwealth Association for Health and Disability, UK. Our organization is an NGO working in the 54 countries of the Commonwealth countries. And our patron is Honorable Elizabeth Madam, Her Majesty the Queen. And our headquarters is London. So our main aim and objective is the same what Professor Natarajan sir and you are having, to sensitize the people about the rights of the children or people with disability, PWD. So with this, I would like to thank Natarajan sir for giving opportunity and command for being my preamble. Most of the things, some of the things which he has said. Can I share my slide, please?
Yes, sir.
Yeah. So this slide already has been shared by Professor Natarajan sir. We are all going to celebrate World Hearing Day, 3rd March 2021. Hearing care for all. That is what is the theme of the WHO. And this also slide which Natarajan sir has said, WHO Southeast Asia is committed to addressing hearing loss and ear disease across the life. He has already said that more than 400 million people in the region live with hearing loss, accounting for just over 25% of global burden. More than 100 million people in the region require hearing rehabilitation services, which by 2050 is expected to 185. And if don't address these issues, then it will amount to nearly $1 trillion international dollars globally, including 110 billion in the region. And WHO is committed to support whatever is taken by the state and country. So finally, the theme of the WHO is nothing but hearing care for all. Screen, rehabilitate, communicate. These are three main objectives. Now coming to key facts, which are some of them are shared by Honorable Natarajan sir. You will be surprised that around 466 million worldwide had disabling hearing loss, and around 34 million of these are children. So I, being a pediatrician, my emphasis will be more on children, and you will be surprised that by 2050, over 900 million people will have disability hearing loss. And why does hearing loss result? Key fact is that it results from genetic causes, complications at birth, certain infectious diseases, chronic ear infection, use of particular drugs, some drugs which can cause ototoxicity, exposure to excessive noises, and aging, which we can see nowadays, DJ, high volume TV, on marriage, then all these things which are going on the horns, they are called. You will be surprised to know, madam and sir, 60% of childhood hearing loss is due to preventable causes. This is take home message. More than 60% जो बच्चों के बीमारी है इसमें hearing loss, it is all preventable. And 1.1 billion young people aged 12 to 35 are at risk of hearing loss due to exposure to noise. This is take home message. As Dr. Natarajan sir said, 1.1 billion young people will be affected with hearing loss if we don't address the noise exposure in the recreational setting. Unaddressed hearing loss poses an annual global cost of 750 billion. So another key fact important is that people with hearing loss benefit from early identification, use of hearing aids as said by Natarajan sir, cochlear implant, which are costly, but government of India, Maharashtra is committed to do under Prime Minister Yojana. Other assistive devices, captioning, sign language. Current estimate suggests an 83% gap. Remember, take home message, madam. 83% gap is there in hearing aid need and the use. This is a very wide gap. We have to fill up this gap. And only 17% of those who could benefit from use of hearing aid actually use one. You will be surprised that over 5% of the world population, or about 400 million people, had disabling hearing loss. Among that, 432 million are adults and 34 million are children. So the chunk of this thing in children. It is estimated that by 2050, 900 million people, there is 1 in every 10 people will have disabling hearing loss. Now, another key fact which is there is that uh, when do you call hearing loss? It is described more than 40 disabled in the beta hearing ear in adult, and a hearing loss of more than 30 disabled in the beta hearing ear in the children. That is what, as per WHO definition, I think Natarajan sir, madam will correct me. The majority of people with disabling hearing loss live in low and middle income countries, Asian, African, and you'll be surprised that 1/3 of people over 65 years are affected by disabling hearing loss. The prevalence of this is greater in South Asian and African countries. Now, you will, after this fact, 2-3 slides on prevention, you will be take home message overall, half of all the cases of hearing loss can be prevented, 50% in overall and more than 60% in children, to public health measures. In children under 15 years of age, 60% of hearing loss is attributable to preventable cause. And what are they? This figure is high in low and middle income, 75% in low income group and around 50% in high income group. Now, what are the things we can do as a pediatrician, as a activist, as a OMAG, as a IAP, as a OMAG, and as a social activist? If you want to prevent causes of childhood hearing loss right from baby, this includes treating infections such as mumps, measles, rubella, which is a very cost-effective vaccine. MMR is freely available. Meningitis, CMV infection, chronic otitis media, 31% complication at the time of birth, such as birth asphyxia, LBW, low birth weight, prematurity, and jaundice, amounting 17%. And not only that, also use of ototoxic drugs like aminoglycoside and some of the drugs, even ibuprofen drugs, they can cause, if they are expecting mothers and babies, can result in 4% of the loss to the hearing loss. Now, another simple strategy for prevention of hearing loss include, as a pediatrician, I will emphasize immunizing all children against childhood diseases, including measles, meningitis, rubella, and I must admit here that this government since last 5 to 6 years had made almost all the expensive vaccine available for all the people, even below poverty line, freely available at medical colleges, primary health centers, sub-centers, and PSC, even all rural remote areas. So kindly take the advantage, immunizing adolescent girls and women against rubella. Rubella vaccine is also very not expensive. It is less than 100 rupees and freely available at centers. Preventing CME infection in expectant mother through good hygiene, screening for and treating syphilis, other infection in pregnant women, and most important, strengthening maternal and child health program, including promotion of self-care. So this is what is the important take-home message. Now, last one slide, following healthy ear care practices, important one. Most important, sir, madam, reducing exposure, which is very high exposure in marriages, in all other functions, in DJ, birthday party, there is a high volume, this thing is going on. So, reducing exposure, both occupational, recreational, to loud sound by raising awareness about the risk, developing and enforcing relevant legislation important, and encouraging individual to use personal protective. See, only legislation is not important. Public awareness and public responsibility, participation of public, sensitization of public is very important. Such as earplugs, noise cancelling earphones and headphones, screening of children for otitis media in the school or even at birth, followed by appropriate medical surgical intervention, and avoiding the use of particular drug which may be harmful to hearing unless prescribed and wanted by. I think these are the major preventive steps. And lastly, referring infants at risk, such as a family history of deafness or those born with low birth weight, birth asphyxia, jaundice, or meningitis for early assessment. Here, I would like to emphasize that Government of India, Minister of Health and Maharashtra should make compulsory all the newborn before they are discharged, whether they are premature with the hearing, which is done in all the foreign countries, European countries, American countries. With BERA testing, they must try to do this. We are doing it private, but it is not done in government sector. So I will request to this or to deliberation. I think let us sensitize the government. Implementing the WHO ITU global standard for personal audio system. Even I was not aware. I tried to use this yesterday, but you need to have earphone. If you use that, you can assess yourself how much is your hearing capacity, how much is the deafness roughly. This can be done by government and manufacturers of smartphone and MP3 player. If adhered to the standard, could help prevent hearing loss due to listening practices that are harmful hearing. And educating young people, very important, population in general, on hearing loss, its causes, prevention is very important. Now, the key message, what should be done by general public, as I already told, good hearing and communication are important at all stages of life. Hearing loss can be avoided through preventive action such as protection against loud sound, good ear care practice, immunization. Hearing loss can be addressed when it is identified in a timely manner and appropriate care could be sought. People at risk of hearing loss should check their hearing regularly, at least once a year or 6 monthly, depending on this thing. And people having hearing loss should seek care from a healthcare provider, even government. Now, take home message for policymakers. What policymakers are supposed to do that? IAS officers, secretary, ministers, and so they are supposed to number of people living with unaddressed hearing loss and yet is unacceptable on any platform. Timely action is needed to prevent and address hearing loss across the life course. What is important? Investing in cost-effective intervention will benefit people with hearing loss and bring financial gain to the society. Integrating person-centered ear and hearing care within the National Health Plan for universal health. This is what we have to address to the Honorable Prime Minister Helmeta. And lastly, the key message, we hope that the World Hearing Day 2021 will be a massive call to action and including Government of India. All sectors can demonstrate their leadership by making this year's event the largest one the country. And you can see that the cost of doing nothing is one we cannot afford. And you can see ear and hearing care is a human right that you can see it 2020. If you don't take care, then the people with hearing loss will be more than 900 million. And lastly, I will end up this thing with this story. As you all know this story, a frog decided to reach the top of a tree. All frogs shouted, "It is impossible, it is impossible." Still the frog reached the top. Why? Because he was deaf and he thought everyone is encouraging him to reach the top. So be deaf to negative thoughts if your aim is to reach your goal. Thank you very much.
Thank you, Dr. Uday. And I think a really wonderful overview as a pediatrician, and also he's actually part of the deputy chairperson of the Commonwealth Health Professional Alliance. And he's the first Asian to get second term on the highest international body, the Commonwealth Foundation UK. So I think we are proud of you, sir, for your contribution, as well as active member of our organized medicine academic.
Right. Honor, sir. Thank you.
We actually invited President Dr. Samir Bhargava, but it was a short notice. So I tried contacting, but I couldn't contact him. But we have Rajalakshmi Rao, who's apart from a good friend. She's doing a great service, and I'm happy every time she actually invited me for her function. She's completed her BCom, MBA in India, and MS Advertising from the University of Illinois, Urbana-Champaign, USA. And after a return to India, instead of taking lucrative career in advertising, when there were hardly anyone with a specialization, she opted to follow her heart and started helping underprivileged and the poor. She and her husband have assisting a 4,500 poor student school and junior college in Vadala, which does not take any donation, and the school is rated as third best in Mumbai. And I'm actually neighbor to it. And I'm glad that they are both are close to me. And this pursuit took her to join Consumer Forum in Mumbai 25 years back for some paltry few hundred rupees. I don't think she took it for the money, but that's what the government paid her. And this dedication to help aggrieved consumers was recognized, and she was elevated to State Commission after 8 years. She was appointed to the Apex Court National Consumer Commission for another 10 years. With 18 years hands-on experience, she wrote 2 books. Consumer is King got translated into 12 languages and revised till 2015. She was appointed by RBI in Consumer Committee. She has been the first lady president of the Indo-American Chamber of Commerce, Western India region, and American Alumni Association. I was actually part of a proud Indo-American webinar, and along with the National Eye Institute, part of the National Institute of Health, Bethesda. And she is presently advisory board members in Insurance Regulatory Authority of India. She has been pursuing to help hearing impaired women across the country, and that's what impresses me. And she every time brings celebrities like actress Juhi Chawla and many others, and I'm glad every time she keeps calling me, and I'm happy to go be a part of them. I couldn't help much, but I'm happy today at the World Hearing Day we are having her. Skilling them and settling them with marriages so that they can directly move into mainstream of life. And I think that's a great contribution. And I keep requesting her to help the people with low vision as well as the people who are going blind. And she's also helping for preventing blindness. And that's my primary profession as an ophthalmologist. On 30th April, 25th year of Pranay Milan event was celebrated by All India Foundation of Deaf Women. Presently, she is the founder chairperson of All India Foundation of Deaf Women and executive committee member of the ACWC, the SARC Chamber of Commerce. She is the executive committee member of the Indian Merchants Chambers. She is a director, Tech Mahindra, Mahindra Aerospace Private Limited, Mahindra Aerostructures, and Global Insurance Brokers Private Limited. She has been recipient of many awards for social work and consumer protection, prestigious Rajiv Gandhi Award for Excellence, the Hind Ratan Sword of Honor in Bahrain, International World Telugu Conference Women of Excellence, FICCI FLO Award of Professional Excellence. She has been helping the Dalit community since last 25 years, and some of them have become top leaders in Dalit community, and one of her protege has received Padma Shri in 2013. And I think I'm also maybe called a protege because I also received in 2013. And for her service and help to the Dalit community, she has been awarded Dr. Ambedkar Ratna Award on April 14, 2016 at the UN in New York on the 125th birth anniversary of Dr. Ambedkar. And she's also part of the Women Economic Forum, which fosters conversation, community connections, and collaborations among women worldwide. And the enabling ecosystem of exchange and sisterhood ignites and inspires greater enterprise and leadership, propelling women's economic empowerment and influence in all walks of life. And I'm a Swami Vivekananda follower, and he always says, if we don't uplift our women, but actually here, Rajalakshmi is already an uplifted women of India, and I think that's what Swami Vivekananda is proud of. He says, when India can respect every woman as a mother and their contribution as a Devi, and I think that's what Rajalakshmi is doing. And over to you, Rajalakshmi, and for your presentation.
Hello. That is too kind an introduction. Can you hear me?
Yes, yes.
My God, it's too kind an introduction, Doctor. I mean, it's very difficult now to match up to what you have said. I don't know, some of these things I've even forgotten, but you pulled up from somewhere. I don't know where. That's not the biodata I normally send. But anyway, thank you very much for your kind words. And
it's more of services you do, and we are happy that you're a friend, and really I want everybody to know the kind heart you have. It's not, I mean, we are all here beyond any appreciation, but I think the idea is we're all come here to serve the people who need because God has given us everything.
such a goodness, and I appreciate your goodness
Yeah,
and
we are also honored, madam, to know about you. At least we
doctor.
could know your vision. Thank you very much on behalf of
I
Kamal.
just go with my heart, Dr.
Yeah,
Uday. It is
I know. Thank you very much.
to us about what you are doing and what you have been doing and what you're still doing and what stage we are. I mean, I'm hearing for the first time all the numbers, and it's a little scary the next few years if we don't really, buck up. Everybody, one of every 10 of us are going to be pretty much deaf. So I think we better really watch out and start working towards that. This accidentally I became president of this no of this deaf foundation in Delhi. Ram Jethmalani just sent them to me saying I want her to be a president because they needed a speaking president. I was too busy in my consumer court activities, but then when I saw them, my heart just died. I said I'm helping people with their voice and their knowledge of consumer rights in my courts, and I have dedicated my life for that. But here are these women who have absolutely no idea about their own rights, forget about consumer rights. And they're poor and they're deaf and they're women. That's in India. So the status in their own home for these girls is terrible from their own parents. Many of them just don't care about this girl child. So I felt very sad, and I said, I have to help. That's my start. And having started in Delhi, then I felt it has to be. I mean, I've come back to Bombay. Now I decided let the whole country benefit of whatever I'm doing. Why only one city? So that's how 14 states have come under this banner. It's a struggle to really do this kind of work, because I don't see great help coming from any particular whatever. So I'm just trying to get some funds, and very frugally I spend it on each chapter and just set up their offices and the secretarial help, and then teach them, skills. That's the only way these girls can become something on their own and not depend on parents or anybody else. So I mean, I feel skilling is most important, because once you skill them, they're so bright, they're brighter than us, because they're so focused. If you teach me and that girl at the same time, she would definitely do better than I do. This is how I find. Uh, I somehow lost connection. Can you hear me?
Yeah, yeah,
Yeah.
yeah.
So I just feel, if you teach them, train them, they can get fantastic jobs and they will perform very well. And so I'm asking them to learn computers. Otherwise, whatever their interests are, some people want to make candles, some people want to do textiles, some work on that, and tailoring and beauty. And so whatever their interest is, we are training them in that field so that they can get a job in that field, because that's what they like. So in all these 14 states, we're trying to do skill centers. And but some of them are getting fantastic jobs after training in computers, and others are also struggling, but we are helping them whichever way. And the another thing we do is, besides skilling, which is the most important aspect, second is, we find, they just don't know how to get married and settle down in life. So we have this program called Pranay Milan, which is now 30 years we have done that. And it started with Delhi. Now across the country we are doing, where we call the boys who are hearing impaired, and also girls who are hearing impaired, along with their parents. So parents speak on the mic, and the children will do sign language and say what they want in their life, what kind of a spouse they want. And so between the family members, they get to meet up, 50 boys, 50 girls. So there's always some matchmaking there. We don't do anything. We just allow all this to happen. And beautifully, some of them get married over the next few months. And all of them come back next year, or some of them with their babies who are normal. And that is the most beautiful part. And when that others see them, so next Pranay Milan, they also feel, okay, this works. So like that we've been doing in Delhi, Bombay, in Agra, and many places we have done. And that is one of our way of bringing them some kind of a comfort in life. And third we do is talent competition, because they're extremely talented. For some reason nobody thinks they are talented or they have any talent, just because they cannot hear and they cannot speak. They can be very talented, better talented than I am. And so we have these talent competitions which we do in some state, called all of them, and then they all come together, And with very small finances, they learn how to dance, and small amount of money that is on their clothes and all that, they wear dresses and all, and they come and dance so beautifully. All the actors who have seen them were completely stunned. Not only us, even the actors, this we need so many retakes, to do a group dance and to go when to go forward and backwards, very difficult to do this, without a choreographer telling them all the time. Here, without hearing, they do such a perfect job. Ideally, I would like to show some of it so you will have an idea. I have asked Rujuta to play this. Rujuta, if it's okay, can you play one of these, one or two? I mean, please, can you play it? Because that is seeing is believing. Doctor, you think Rujuta can hear me and play?
Yeah, Rutuja.
ஆமா ஆமா நான் அப்பப்போ பேசுறேன்.
Madam, have you shared
Okay,
it?
Rujuta, I've sent it to her. She said she'll play, and I should tell her when she should.
Yeah, I think she made a rehearsal before you can.
ஒரு செகண்ட் ஒரு செகண்ட்.
Somebody has joined from both.
No, I think Rutuja is playing.
Yeah.
You're muted.
Rutuja tried to.
Yes, ma'am. Yes, ma'am.
Them,
You're muted. You're unmute yourself.
One of you have to.
prize, second prize, and
If you are connecting from both PC and mobile, then there will be echo.
oh, yeah.
Yeah.
No, I can't see. I'm not playing. You are muted. Yeah? You are muted. You have to go there.
Yeah, it is playing.
I think it's coming without sound. So I'm maybe 2, 3 people there in the same room.
I think you both can. Ask them, no? Rutuja, Raja, can you see?
I
Is
can
it playing?
see it's not playing. It is just
Play.
without
Play.
sound coming.
Ah.
Ask her to put sound to it.
You can see that, no, Raja?
Yeah, I can
Yes.
see. Can you have sound also, Rujita?
Now can you see?
Yeah,
The sound is.
sound is not coming. Actually, song also comes.
Okay.
But I wanted you to understand, I mean, look at the way they would do it without hearing. And we give them prizes.
This one national conference.
Yeah, it's a national talent competition.
Okay.
And they all come and they go back and they're so happy and they're so proud because this is the only platform they have to showcase their dance and their acting abilities. They also have plays, and then they have other flower decoration, painting. We give them prizes, and they go back and to Kerala, wherever they've come from, Haryana, and they go back and show off to everybody. It's a national competition, and I won first prize or second prize, and they get that importance in their own community and everywhere amongst their own friends and the deaf community. So it gives them a status, like how everybody in civil society has that status. Somehow that status is not given to them, so I give them that so that they have that pride that they are very good at whatever they're learning. So this is how we have been doing. And luckily, whenever we have this talent competition and also the Pranay Milan, I have to, I mean, I'm trying to show off, but then I think I would like to also express how good the judiciary is, maybe because I worked, in that line. And I mean, today the sitting judges of Supreme Court, right now also, they've all come. And the previous ones, they've all came for as a chief guest at all our functions without blinking an eye. I mean, in a 10 days time also, if I request, they would still come, and always blessed. I mean, that kind of support we have. And we also had people like Poonam Dillon and Juhi Chawla and various actors who have come in at various times. And even a US consul general from Mumbai, he had come. He's now number 2 in the US embassy in Delhi, David Kagan. And I'm just saying, people, when they come for half an hour and they cannot get up because to leave, because so beautifully these girls are dancing, and their happiness is absolutely, it's infectious. You feel so happy for them. And so this is where I stand. I mean, I just want to keep working in that line. See, medically, what you're trying to do is something which I am not getting into, except I tell them what is right and all for them. But that is something which government and all of you need to do, rectify the situations and all that. I'm only helping people who are already deaf, right now deaf, and
Okay.
they're lost in life. And these are the people I'm helping, to get them back into life and skill them enough so that they earn money and they're not dependent on their parents. And they can get married, and if they get married and have problems, we also help them with their issues. Legal counseling we do, that's another thing. And the government also has recognized us as because we are the only organization meant for women in the country. There's no other deaf organization for just women. So we are the largest. So we have also all of them must learn the same sign language. So we are also connected to government. We are members of that. So we are also skilling them and teaching them the same common sign language in all the states, so that they and their parents also understand, because each one speak differently. Their sign languages are different in every place. So they don't understand each other. They also can't communicate properly. So we're trying to standardize, because Prime Minister Modi had actually brought it in, saying there should be one common sign language for us. So that is what we are trying to now teach in all these centers. And anyway, we are that's where we stand. I don't want to take more time, but I'm extremely honored that I'm given a chance to speak on World Hearing Day with Dr. Natarajan, who's such a kind human being, besides being a friend. And I'm very thankful that Dr. Uday is hearing me about it. And wherever you can put in a word and help us out,
Yes.
because I don't have too many voices in my thing, because we are a silent
Thanks
organization.
to
So in that silent
thanks to Entod.
organization, we need speakers
No,
like.
thanks to Entod, it's going live all over the world, and
uh,
it's going to be it's already live in the YouTube and in Facebook Live. It's not only Uday is listening; many are listening, and all our
I'm,
executive
I,
committee of organized medicine had some other program, and I
mm,
think Raman will be able to tell. Entod is actually stands for ENT, that is ENT pharmaceutical, and OD for ophthalmology.
mm,
So they are actually
both. Okay.
pharmaceutical company
mm,
supporting both ophthalmology and ENT.
mm.
And another one is Uday. I don't know whether you realize, like Rajalakshmi Rao is looking young only because of the blessings, and she's found her blessings are
Yes,
good.
sir.
So I
I
think she
agree.
has to bless her. Instead of we helping her, she has to help us actually.
I know.
And
I
not only
fully
that,
agree.
I all the time I'm selfish for preventing blind, and she wants to prevent deafness. So God has given me a president post where I have to talk about 25 medical organizations, not only
Yes.
ophthalmology.
Yeah.
So I think we are into now we are totally into vaccination and other lot of things with our Ishwar Galara is the president of AIDS Society of India, and we have Professor Sunil Raina
Sir.
from he's a professor of preventive and social medicine, and the next president will be Dr. Sunila Garg. All are involved with government health ministry today, and I think in between I added this. I tried getting Dr. Soumya Swaminathan. I hope one day she will address us. But
Sure.
uh, I think with all this Mr. Raman, can you come on line and maybe you can tell us last few words what you have done today along with the ENT Association, Raman?
Yeah. Yeah. Sir, before Raman, can I say a few words?
Yes, yeah, sure, sir. Please,
Firstly, I would like to
please.
congratulate you personally and Raj, Rajalakshmi Rao. I have heard you first time. Really salute you for your all visionary mission and dedication. I would like to, because our organization is mainly involved with Commonwealth Association for Health and Disability Issue. So only one suggestion, our association was known as Commonwealth Association for the Handicap. So when I took over the reign of the international president, I said handicap word is not suitable. So we changed it to disability. Now disability changed to specially challenged. So my humble submission that instead of calling for your foundation for deaf, can we change it, because we are changing to specially hearing challenge or something like that? Because calling somebody as blind or somebody as deaf or somebody as mentally retarded challenge, calling them specially challenged people.
Dr. Uday,
Yeah, I'm not sure
need to
whether
think
it is
of it
PGM. Just
when-
my suggestion, because
Yeah.
because today is a hearing day, so we can suggest to government, because government is government is
So what
changing.
happened, Dr. Uday, I asked the same thing to my people, because these are the people who are
I know.
actually hearing impaired.
Yeah,
So I'm only helping them. At the end of it, they call the, I have to take the permission for anything.
I know.
So when I was making this All India Foundation of Deaf Women, I wanted to change it because earlier this Delhi Foundation of Deaf and Dumb, they used to use this dumb also. Dumb is now not allowed. So I
Allowed.
told them that is, you have
Even
to.
blind is not allowed.
Blind is
Rajlakshmi,
not-
even
yeah.
blind, unfortunately, NAB is there, which
Yeah.
is founded by Jawaharlal Nehru's time,
Yeah.
National Association for Blind. But
Yeah.
even the blind, they call it a bad word now.
Yeah.
You
So
have to call it
And I think in
visually
presentations,
challenged or
Parliament-
hearing challenged.
in
So I-
parliaments, I think they cannot use the word blind.
Or you, what you can do,
I
you can
asked
use
my girls.
you can use Divyang, and in the bracket you can hearing challenge or
I actually asked them, I said, let us not use the dumb anyway, but why don't we use this All India Foundation for hearing impaired women?
Yeah,
This
hearing
is what I
impaired.
said.
Yeah.
But they said, no, we don't understand this word hearing impaired.
Oh,
We only
God.
understand the word deaf. They were very clear. In fact, the
Yeah,
best also they don't want. They're very clear. No, we are used to not hearing anybody. We don't want to hear anybody at this stage. We are too old. When we're small, that's different. Not now. Even if I'm willing to give them free, also they don't want because they get mental challenges.
I agree with you. Yeah, even my organization, they are not ready to change from handicap. I said, Government of India will not give you any grant. Remember, WHO, UNICEF has said, don't use disabled
They were not
handicap.
letting me change the name even. So but I have to leave this word that because of them.
I know. Anyway, thank you very much. And I must, Natarajan sir, I would like to thank Rahul Jain, then Rutuja, Rohit Kumar, and Raman Marke, who are the organizers of start on behalf of Kamar and behalf of all of you. And with this, I think I'm really grateful.
Yeah.
We can hand over to him. Thank you, madam. Thank you.
Yeah, sure.
We try to
We want to thank.
anything,
we want to thank Kishore Masurkar.
anything change is very difficult, but we have to pursue changing the names.
Gandhiji has said, and Barack Obama also repeated it. And I think that is change is the constant thing, and change is the only thing we have to see. And
Yes.
Gandhiji said, see the change what you want. So
Yes.
I think I am doing that in ophthalmology.
I
He
know.
is doing in deafness. Doesn't matter about the name. You
We
are
are
doing
doing-
in
we are
pediatrics
doing
and,
disability,
or adult
handicap.
medicine.
Thank you.
Yeah, we'll do that. And I know we have to thank chairman of the NTOD, Mr. Kishore Masurkar, who is also a Rotary president. His son, Mr. Managing Director, Mr. Nikhil Masurkar. They are a solid support for both ophthalmology and ENT. And I want Mr. Raman to say a few words what you did today on
Okay.
World Hearing Day by
Raman.
NTOD with the ENT Association. Raman,
Okay.
and then we can conclude. Raman? Raman, can you hear? Raman, are you there?
Yes, sir. I'm here. 1 second.
Yeah.
Yeah, I'm very much here, sir. I would just like to.
You're echoing.
You are joined from two. Yeah.
Yeah. He's in the office, I think.
Yeah. Very good.
Yes. Yes, Raman.
Yeah.
Raman?
So on the this World Hearing Day, 23rd March, we have done a lot of activities, sir. So this flyer, it was visible. So it's communicating the complete the theme of the World Hearing Day. So this we have circulated to all the medical fraternity, and along with that, in the 3 newspaper, There is the Times News Now, the Health side, and the New Indian Express. So in this, the entire and the ENT medication consultation features in the media on the occasion of the World Hearing Day. The aim is to raise the awareness and how to prevent the deafness and hearing loss and promote the ear and the hearing care across the world. The international media campaigns will be in the print and the electronic media across the country. That has been published. And today, just now, 1 hour before that, we have done one webinar with All India Otological Association, and it has also got a good response. Now, this is the second webinar that we are conducting along with the OMAG for the creating the awareness on the occasion of the World Hearing Day. So, thank you so much, sir. And our team across India, they are conducting the more than the 300 camps across the nation. So, our GTech team, complete manpower, they are like celebrating it with the creating the awareness camps and some awareness programs also conducting across India. Sir. Thank you so much. Sir.
Sure. So thank you, Raman, and thank you, Entered, for doing a wonderful job. Thank Uday for representing both ComHAD and OMAG, and thank Rajalakshmi Rao for doing. And we are all there, Rajalakshmi, and that's why I'm introducing to so many of our groups so that all of us are ready to support
I'm
cause.
totally indebted to you for
Thank
your
you.
Thank you.
Thank you, sir. Thank you, madam.
Yes,
We'll be in touch with you and both of them.
Namaskar.
Welcome, yeah. Thank you.
Thank you very
Bye.
much.
Yeah.
Thank you. Can I log off?
And we can go offline. I think so. Only 1 minute, Raj.